Wisconsin.
Shortly, I will move to table Amendment 3947 for the purposes of offering my amendment to extend the Affordable Care Act tax credits for 1 year. I am doing this because my Republican colleagues are refusing to act to stop health care premiums from doubling for over 20 million Americans. I just can't stand by without a fight. Americans have said loudly and clearly that they are in a health care crisis. That's not up for negotiation, but it didn't have to be this way. We're at this moment because Donald Trump and congressional Republicans have simply refused to address the biggest increase in American premiums they'll likely ever experience. For months, congressional Republicans and Donald Trump have refused to even talk to us about addressing it. Estimates show that 22 million Americans will see their premiums double on average. I'm getting calls daily from Wisconsinites begging me to stay in this fight. A couple in Door County, Wisconsin, told me their premium is rising by over $550 a month next year. Everything is already too expensive. So where are they supposed to find $6,500 extra in their budget? Another couple from Butternut, Wisconsin, told me their premiums are going from $400 per month to over $5,000 per month. That's $55,000 more a year. As they wrote to me, healthcare tax breaks are not just numbers on paper. They are the lifeline that allows us to sleep at night knowing that we won't lose everything if one of us gets sick. Behind every one of the 22 million Americans who rely on these tax credits is a story, a family who has to put together a budget, who has to make the hard decisions of what they can afford for their family next year. Some are logging on to healthcare.gov right now and finding that they simply can't afford health insurance next year. That is unconscionable. Addressing this demands that we act now, not in a week, not next month, but now. That's why a handshake deal with my Republican colleagues to reopen the government and no guarantee to actually lower costs is simply not good enough. The people I work for need more than that. They need health care that they can afford, not a symbolic vote. For over a year now, I've been fighting to get a bill passed to avoid this very situation and make these tax credits permanent. My colleagues and I have tried every which way to get this bill passed. Every time my Republican colleagues killed the effort and put 22 million Americans on the path to pay more for health care next year. For 41 days, I've been clear. I will work with anyone to reopen the government and lower Americans' health care costs. And I'm not throwing in the towel until we've exhausted every option to make that happen. And that's why I've offered an amendment to extend tax breaks for Americans who buy their insurance through the Affordable Care Act for 1 year. My amendment is as straightforward as it gets. It would extend current law for 1 year, stop costs from skyrocketing for our constituents, and give us time to negotiate on health care costs without leaving 22 million Americans in the lurch. Is this everything I think we should do? No. We should make health care more affordable for everyone forever. But I am willing to compromise to avoid catastrophe for the families I work for. I am demanding that we take this vote so that we can actually provide some relief to millions of American families. The American people are desperate for health care that they can afford and demand that we do everything in our power to lower costs. This is a tool in my toolbox to try to lower their costs, so I'm using it. I've talked to so many of my Republican colleagues who want to do something here, who want to keep health care costs down for their constituents, who know their constituents in red states and districts will be hardest hit. Well, now is the time to show it. My sincere hope
time has expired.
is that the Republicans join me so I can make this amendment to the continuing resolution and let 22 million Americans rest easier. I hope my Republican colleagues choose to join us. And now I yield to Senator Sanders.
I want to thank the Senator for Wisconsin.
Senator from Vermont is recognized.
Thank you. I want to thank the Senator for Wisconsin for offering this important and very simple and straightforward amendment. Nothing can be simpler. Are you prepared, I say to my Republican friends, to sit back and allow over 20 million Americans to see a doubling of their health care premiums? In my state of Vermont, people who are 65, 63 years of age will in some cases see a tripling or a quadrupling, and that is the case in your states as well. And all that Senator Baldwin is saying is, let us take a deep breath. Let us make sure that people do not see an outrageous increase in their premiums. Let us not pave the way for 15 million Americans to lose their health care entirely because of savage cuts to Medicaid. All she is asking. Now, I noticed that recently some of my Republican colleagues are beginning to talk about the health care crisis. Well, during Trump's first 4 years, he had virtually nothing to say about the crisis, nothing to say about it in the next 4 years, but I'm glad that there is some discussion. The truth of the matter is, in my view, that the current health care system is broken, it is dysfunctional, and it is cruel. But I want to ask my Republican friends a simple question. Are you happy with the fact that here in the United States we are the only major country not to guarantee health care to every man, woman, and child? We are unique. That's not the kind of exceptionalism we should be proud of. Are you happy that we are paying twice as much per capita for health care, over $14,000 per person, than any other major country, and yet we have 85 million Americans who are uninsured or underinsured? Are you content with the fact that the insurance companies and the drug companies are making huge profits, paying their CEOs exorbitant salaries? Are you happy with that? Are you happy that patients in America have to get on the phone and fight like crazy and deal with all kinds of bureaucrats in order to get the health care that they paid for in an incredibly complicated, broken system? So if you want to have a debate about health care, let's have that debate. I happen to believe that we should join the rest of the industrialized world, guarantee health care to all people through a Medicare for all single-payer system. You got a better idea, bring it forward. But what we should agree upon is that you don't raise premiums by 100%, or in some cases, triple or quadruple. Let's take a deep breath. Let's extend these ACA subsidies for another year. Let's have that debate on health care. That's what the American people want. And with that, Mr. President, I would yield to the Senator from Michigan.
Thank you, Mr. President.
Senator from Michigan is recognized.
Thank you, Mr. President. I rise today in support of Ms. Baldwin's amendment on a clean one-year extension of the healthcare.gov credits. Since July, I'd been really clear. If you want me to vote on a deal, it's got to do something to bring down the cost of healthcare because of the healthcare crisis that Republicans in this chamber precipitated back in July. Just to review the bidding. In July, the big, beautiful bill, which all of you voted for, most of you voted for, slashed Medicaid and slashed coverage for people on healthcare.gov. Now, all our hospitals, all our healthcare systems, all our nursing homes, everybody accepted that and started to plan. In response to that, the hospitals said, well, look, people are still going to come. They're still going to get in car accidents. They're still going to have heart attacks. They're just not going to be covered by health insurance. So we're going to have to charge the people with insurance even more money. So we are now at a point, this crisis that's been precipitated has led to the fact that every single American, everyone watching, everyone listening, is either facing losing their health insurance or paying more. And that includes people on private employer-provided insurance. When we take a step back and we look at all the people that are going to fall off health care, all the healthy young people who are not going to pay for health care anymore, it looks like across at least my state, every single person is looking at their prices doubling. Not just the people who are affected by the big, beautiful bill, but the bill payers, the people on private health insurance. Now, no one in this room would say that we are paying too little for health care right now. And I don't always agree with Senator Sanders, but I can say there is no more broken system in America than health care right now. It needs full rebuilding. We may disagree on some of the ways to do it, but the Republicans have offered zero plan, zero ideas. Hell, Marjorie Taylor Greene is talking about how Republicans don't have a plan. Never thought I'd be agreeing with her. So today, all we're asking for is a clean one-year extension. No one says Obamacare is perfect. No one says a clean extension is perfect, but you have pushed people back into a corner. You have said we're going to pay for our tax cuts on the backs of everyday Americans by using their health care as the bail payer. So can we do a one-year extension, please, so that we can have some kind of conversation, a real conversation, that the American people expect people of our stature to be having? Can we have that conversation over the next year, but not, in some cases, have people's health insurance go up by 600%? That is what you have precipitated. So to every American watching, whether you're on healthcare.gov or you're on private insurance, if you're getting those letters, if you're getting those notifications of an increase of your bill of $200, $500, $800 starting January 1, my peers on the other side of the aisle are the ones you should lay it at their feet. Because they have put us in this place, and if they vote tonight against this, it's because they don't give a crap about the cost of your health care. They don't give one single crap about it. So I hope my colleagues find it in their hearts to say, let's fix the system, fine, but at least for now give us a one-year extension so we can have a real conversation. With that, I yield back.